Hello and welcome to Health Bytes. Health Bytes is brought to you by the Public Health Unit of the Ministry of Health and Social Development. I'm your host, Public Health Communications Specialist, Natasha Latham-Humphrey. Today on the program, we have with us our Chief Environmental Health Officer, Mr. Lionel Michael, and our National Epidemiologist, Ms. Harmony Bruley Messiah. Welcome to the program.
Thanks for having us. Good morning.
To be here.
Wonderful to have you here. Now, we just faced Hurricane Ernesto. We're in the midst of the peak of the hurricane season. And, having you on here signifies that we're talking about these pesky mosquitoes. Mr. Michael, I understand that, you've launched a mosquito awareness campaign. Tell us a little bit about that and its importance.
Well, it's important for the campaign and to launch the campaign because we want to create an awareness. We want to strengthen, I should say, an awareness to create full awareness in people of the importance of mosquitoes in the BVI. From the standpoint of transmitting diseases, from the standpoint of being nuisances, and from the standpoint of having an economic impact upon the BVI. And so we want to give people provide the necessary people, persons with knowledge and skills about the mosquito so that they can take action at their own household and community level. So that's the real purpose of the campaign and awareness.
Well, I love that response because too many times a lot of people think that, the mosquito eradication is the work of the government.
Yes.
And if they don't see the government acting, the government is at fault for any other public health stuff that may arise. But, as you say, it needs to start from the community, and we'll get into that. But we want to hear from our national epidemiologist in terms of the importance of the campaign from the public health perspective.
Okay, well, Mr. Michael deals with mosquitoes. All he cares about is his mosquitoes. But my role is really to monitor the diseases and to ensure that we actually reduce the level of the burden in the territory. So from the public health standpoint, it's important because the mosquitoes are very effective vectors. And it's not just dengue, right? We have Zika. We had that outbreak a couple of years ago. We had chikungunya. We had that outbreak a couple of years ago. And we're actually seeing increases again throughout the region. We have the Oropouche virus now that is on the rise that the World Health Organization has been sounding the alarm about. And of course, we have dengue. But there are other diseases that we need to be cognizant about. And we have the vectors here. We have the mosquito vectors here in the BVI, which means at some point in time, if it gets here, it can spread just as easily as it does in other countries. So we definitely need to highlight that. And that is part and parcel about why we are doing that. We also need to educate persons on how to prevent mosquito breeding sites, and how to control mosquito breeding, as well as we want to understand the factors that is leading to a lot of breeding that we're seeing on the premises. Because as you rightfully said, it can't just be a government, right? It can't be a top-down. We have to actually start from the grassroots, from the community, and say, you have a social responsibility to ensure that your environment is clean to reduce breeding sites, not just for the community at large, but to protect you and your family.
Definitely.
How many mentioned that the vectors in the BVI? And when we say vector, we're talking about here the mosquito, Aedes aegypti, and I would say clearly that the majority of people in the BVI can tell and know it's the Aedes aegypti mosquito. Because it's a black mosquito with white stripes. And most people will say, I see the black and white mosquito.
Yeah.
When they call to make a report, I will say, sure is what kind of mosquito you see around your home? I see biting you. I see the black and white one. And then they will tell you this is some black one, and some dark ones, and so on, brown ones, and so on. But generally speaking, they can identify the Aedes aegypti mosquito, especially in the adult stage. Because we have done, even before my venture into the BVI, a lot of education has been done about how to identify the mosquito. Yeah. All right, so people know it. Physically, they can tell you that. However, let me just say quickly, that the mosquito lives around our homes. In the house and in your yard and on your premises. There's where it live. And so, it also can have a life cycle of 7 to 13 days from time it lays eggs until it become an adult. So it's a whole 7 days, and with climate change, and the Ministry Natural Resources and the Climate Change Program and so on, we into that, and the climate change can reduce the life cycle to shorter days, maybe 5 days, maybe 3 to 5 days, and so on. So we're talking about a lot of mosquitoes in short time. It can live for a month. And during that time, it can lay 300 to 700 eggs, one mosquito, one Aedes aegypti mosquito. So imagine you have 10 mosquitoes, 15 mosquitoes, 100, and so on. What else? The eggs that it lays can survive drought conditions. So if no rain is coming, if no water is available, the eggs stay in the container until you get water. Hatch.
Yeah.
No, the Aedes aegypti mosquito is very smart. It lays eggs in the containers, and what it does, substances there that glue them to the container. So when you wash your container, you have to scrub them as a control measure.
Yeah.
You can't just rinse them out because the eggs will still remain. Another thing about the laying eggs, it does not put the eggs in one basket, as we say locally. Put the eggs in several containers on your premises. So you just not let the eggs in the drum or the barrel, you lay it in whatever container is available on your premises. That is why it is critical to keep your premises, your yard, clean. All right, so with, what else? Eggs laid in clean water. Clean water, we call it the lady of all mosquitoes, sophisticated mosquito. All right? You just don't breathe in any dirty water, you see, stagnant water. But again, with climate change, all that is changing. Biting. It bites persistent. It is persistent in trying to bite you. Intense mosquito trying to bite you, not letting up.
Yeah.
You bet your last dollar it is a gypsy mosquito. Over your head, your ankle, and your hand, and so on. Doesn't give up until it succeeds. They need blood for fertilize the eggs. Only the female mosquito bites. The male does his normal thing, copulate, and then the male dies. Male mosquito feeds on plant nectars and so on. But the female need the blood. All right? What is about the biting? The biting, the mosquito can bite several persons. One mosquito can infect a whole household. So if, for some reason, one person has dengue, that person has to protect themselves from mosquitoes. Because mosquitoes, that Aedes aegypti mosquito, can bite that person and then acquire the virus from dengue from that person and then bite other persons in the household. That's why generally sometimes a lot of people sick in the household.
Yeah.
Because one mosquito is biting everybody. And then when it finish infect the household, you go to the other household, and even household 200 yards away, 200 meters away to bite people.
Okay, so question. I appreciate the history and what's going on with the mosquito. And I'm going to come back to my question in terms of, preventing mosquito breeding at each stage. But, as you were just talking about, biting the mosquito, I think, Parsons, I thought that you get dengue from a mosquito bite. So if the humans have the dengue virus and it's transmitted through the bite of the mosquito, then how do you get dengue?
How many answer that?
But you just technically explained it.
Because if you start with the infected mosquito biting persons, if you start with a person who has dengue, generally infected person having the dengue virus, or the mosquito may have the dengue virus and then transmit it to people.
So it's almost like chicken versus egg.
Right,
What
which one
came
come first?
So if the mosquito is infected, and let's say it bites Mr. Michael, it's going to transmit the virus into Mr. Michael, where it's going to replicate until the viral loads increase, right? Another mosquito comes along and bites Mr. Michael, who's infected with the virus. It's going to take the virus into its body, where it again replicates, and then it's going to bite you, and it's going to pass the virus on to you. I think a lot of people don't understand that the mosquito is a living organism. It moves, it respires, it reproduces just like us. It reacts to stimuli, okay? So it stands, if it has characteristics of a living thing like us, it can get infected just like us. So which is why we always tell persons, if you have dengue, cover up, because they're going to be mosquitoes that are not infected, that when they bite you, become infected, and that cycle continues.
Right. And that is serious. So we have to control mosquitoes and we have to control the people.
So another conversation is, I know sometime back we, had a release out regarding, trying to educate persons about what we're talking about now, protecting themselves and, reducing mosquito breeding. And, there was a lot of comments about people will say, the case is rising, but it's much more than that, because I believe I had dengue and my neighbor and these set of people have dengue, but we didn't go to the doctor and so on and so forth. So if persons suspect that they may have dengue, what would you like them to do?
Okay. Before I even answer that, I want to address something, because usually whenever we put out case numbers, right, you usually get that kickback. Oh, those numbers are so low. We are a small territory. We're not supposed to be seeing large numbers like Barbados and Trinidad and Jamaica that has over 100,000 persons and what's not. Right? So our threshold for outbreak is going to be lower. Mm-hmm. And there's no country that is going to have 100% accurate statistics, because just like you rightfully pointed out, there are going to be people that are asymptomatic. Mm-hmm. They don't even know that they're sick, because we do have asymptomatic carriers, right? We have persons that cannot afford to go to the doctor or don't even want to go to the doctor if the symptoms are mild. So every country will miss a subset of persons, all right? So we can only go off of what is reported to us through the community and the healthcare providers. So there will always be that margin of error, okay? Now, if you suspect that you have dengue, you're having these symptoms, because dengue has ILI, influenza-like symptoms. So you have the fever, sometimes you have the rash, you have the headache, you have the eye pain, you might have some sore throat. So you might think you have the flu, right? And which is why we always tell persons, if you have these symptoms, regardless of what you think it is, you need to get it confirmed. You need to go to the doctor, you need to take the sample, you need to send it to the lab and get confirmation of what you have, because the treatment is different. The treatment is different from the flu, treatment is different for dengue. It's usually supportive in nature because there's no cure, but it is different. So if you suspect you have dengue, isolate, call the healthcare practitioner, go and see your healthcare practitioner. Go and get the sample taken to be sent to the lab for confirmation. The healthcare practitioner, by law, is supposed to report it to the public health unit. Right? Now, you as a citizen, if it comes back that you have dengue, you can also call the public health unit or the environmental health unit to report that you have dengue. Because once we get those reports, we then go to your residence. Okay, and this isn't a punitive measure, because when persons hear that we're coming to do an assessment or inspection, you get this kind of like, almost like we're coming to find something, and and that isn't exactly what it is. We just need to make sure that your premises is safe for you and your family. So we come and do the assessment, and we be like, okay, hey, you have some breeding here, is this type of mosquito, and this is what you need to do to eliminate the breeding sites, and this is what you need to continue to do. So it's more like education and, practical hands-on knowledge that we give you when we come to do the assessments. So it isn't punitive. We're not writing you up to send you to court or anything like that. We just come in to ensure that your residence is safe for you and by extension the community.
Right. Anything you want
That
to
is
add?
very important point made, because the suspected dengue may turn out to be dengue. And therefore, we work closely with public health and the community. If we get reports of suspected dengue, environmental health, vector control unit will proceed to the area from which we get a complaint and do an assessment. We inspect the premises, because if you turn out to be dengue, let me back up. If it is suspected, we don't want mosquitoes that are not infected to be biting the person. Because if it's turned to be dengue, those mosquitoes would have been infected already and keep biting other persons. So we definitely want to come to your premises, assess your premises, assess the premises around you, whatever certain distance we use, and to identify and destroy mosquito breeding places. Okay, we check your entire premises for your containers, your barrels, your drums, old fridges, anything that can hold water, especially things like the toilet bowl that they may change and have them in your yard still, cans, bottles. If you have old cars that provide shelter for mosquitoes and collect water, we want to bring that to the attention of National Solid Waste, of Waste Management Department, to assist in that regard. But we want you to protect yourself too, because we don't want other mosquitoes to bite you. So we encourage long sleeve shirts, long sleeve blouses, long sleeve pants, and so on, during the time that you suspect you may have dengue. It may very well be have it, and fine. If it turns out to be negative, that is fine. But we don't want to have a strong suspicion index and don't do anything. So we're going to move to the area and we're going to do the assessment, both entomologically for insects, for mosquitoes, and the public health people could investigate for dengue and so on. We have your bin, what are your symptoms, and so on and so on and so on. Very, very important, because that's how the dengue spreads a lot. People don't take it seriously because they think it's a flu, and it might be very well be dengue. And you're walking about the place, mosquitoes zap you.
And I think that it was very important that you brought up that dynamic with the actual transmission of dengue. I know the show ain't solely about dengue. We're going to get back to the campaign. But since you guys, started to talk about it, we just, kept the flow and went down this road. But, even sitting here and understanding it better now, it's imperative that persons who have dengue cover up and take protective measures. I joke all the time, like, I don't mind being bitten by a mosquito in my yard, but I don't like to come on the road and get bite by other mosquitoes.
But see, when they bite you in your yard, may come from somewhere.
Exactly.
It may come from 400 meters away.
Exactly.
And it can fly 400 meters away. So if you suspect, if you put you that you may have dengue, we would estimate 400 meters from your house in all directions.
Yeah.
200 first and 400 in all directions, and try to find the breeding places. But you mentioned an interesting point about people covering up, and also important is people taking action at their yard level, at their house level, at their community level to cover up their containers.
Yeah.
Especially if they use, a lot of people, some communities, because of water challenges, store water.
Definitely.
In drums, in buckets, cover them properly. Because without water, we have no mosquitoes. Egg will stay there for a long time. Without mosquitoes, we have no dengue. So we need to definitely control the mosquito at the household level.
Yeah.
Cover a container, turn them over, ask solid waste for assistance, and so on.
Yeah, this is very important because once we start to mobilize the community and teach them exactly how to prevent and control mosquito breeding, this has a knock-on effect on other mosquito-borne diseases. Because yes, we're focusing on dengue, but like I said, Zika and chikungunya are back on the rise. We're seeing the oropouche virus. We had a case of malaria 2 years ago. So so diseases don't respect borders. We saw it with COVID. We saw, it started from China and then trickled and trickled and trickled and trickled, and eventually somebody brought it here. And that is what a lot of countries are reporting. A lot of imported dengue cases, a lot of imported Zika cases, a lot of imported oropouche cases. Travelers are bringing them in. And because we're experiencing a lot of outbreaks throughout the Latin America and the Caribbean, you can go to St. Vincent, maybe Trinidad, some other country in the Caribbean, and unknowingly, get infected with dengue, and then you come back to the BVI and you bring it here. And what people need to understand is that there are 4 different dengue serotypes, right? So we know dengue is a febrile mosquito-borne viral infection. And there's serotypes dengue 1, 2, 3, 4. So 4 different types of viruses. BVI used to have 1 and 2 circulating here. But if you go to St. Vincent or some other country and you pick up maybe dengue 3, dengue 4, the people here are what we will call susceptible. We're a naive population because we've not been exposed to types 3 and 4, which circulate in other Caribbean countries. So you come back, you're feeling ill, you're not going to the doctor, you're passing it off as maybe a cold or flu and what's not. And mosquitoes bite you, they infect other people. And this is a totally different dengue virus now. What's going to happen? We're going to see an outbreak. Because now you are exposing susceptible people to a new virus that their body has never experienced before. Mm-hmm. And this is very important because when we get exposed to the new virus, it could actually increase your risk for severe dengue or hemorrhagic dengue. And this is a dengue that would put you in the hospital. This is a dengue that is fatal, all right? And this year, we have actually been seeing increases of severe dengue, persons being hospitalized for dengue. So it's not, yes, it is a mild disease most times, but oftentimes for like children, the immunocompromised, pregnant, elderly, we're seeing more cases of severe dengue. Yeah. So we definitely need to be more aware.
I'm going to mention the movement of people and the movement of dengue with people. Also, you can have the movement of mosquitoes with people. You can go to a country, put your clothes in a closet for a week that you're visiting, and then you pack your case in a suitcase, pack your clothes in a suitcase. Mosquito might be in your clothes. You leave the mosquito. And you can bring them from the country to the BVI. And as soon as you open your case, your suitcase, they fly out.
Yeah.
Happen all the time. Yeah. One morning I was home, I live in the east, mosquito come in the car, one in my car glass. As soon as I reach Chico's Bay, I went down DMV, open the glass, wine and glass, the mosquito fly out.
So if any persons at DMV come down with dengue,
exactly. So these mosquitoes move with people. That is why when you go on a flight, sometimes they walk down the aisle with a little can and they disinfect the aircraft. Hopefully, they hope that there are challenges with that, but we talk about that another time. And try to spread the aircraft. Because when you open the door, mosquitoes come out and then maybe infected mosquitoes and bite people. So dengue move, infected people can come in. And yes, they may say, okay, what about the port? We're not looking at people when coming at the port. Sometimes it's difficult because people may not show no signs and symptoms when they arrive at the port, but once they're in the country, they begin to manifest signs of dengue.
Yeah.
So it's a challenge.
And if you know that you're sick coming into a country and you know that there's screening at the port, what's the logical thing you're going to do?
Present your best self.
You can present you, but you could be dying on the inside. If you know BVI has screening processes at the port, you're going to make sure you take some type of fever suppressing drug, ibuprofen, whatever it may be, so that you are well enough to pass that initial screening. And that's what happened during COVID. And then once you get in the country, you go to the doctor. So screening at the port, at least temperature screenings, don't make any sense.
And, you know, bringing all of this up and, you know, kind of laying out why it's important for this campaign. You know, now that we know the why, tell us how. How are we going to get persons involved? Because we this top-bottom approach dying effective. From the ground up, that could be sustainable. So how are we going along with that?
We, in our Mosquito surveillance program in the Ministry of Health and Environmental Division, we go house to house. We do house-to-house inspection every day, up to Friday. Sometimes we go on weekends. And we will do an assessment of the situation, and we can tell you high-risk areas in the BVI, low-risk areas in the BVI. And so we want to focus heavily on the high-risk areas. When I say high-risk, I mean areas that have a lot of mosquitoes. Containers and people premises are breeding a lot of mosquitoes for dengue and chikungunya and Zika. The other mosquitoes that are affecting people, we call them the nuisance mosquito. Now, we're not going to say we're going to only kill an Aedes mosquito, which we are definitely laser focused on. But we want to also deal with other mosquitoes affecting people, because people don't like mosquito bite, right? Any mosquito bite, people have a kind of reaction to mosquito bite. I don't like mosquito bite me. Whether it's Aedes, Culex, nuisance mosquito, I have allergic reaction to mosquito bite. All right, so I understand how people feel. So we are focusing on all mosquitoes, but we are laser focused on the Aedes aegypti mosquito, because that is the one we know that is deadly, that is transmitting these dangerous diseases, and that is the one we want people to get actively involved in, to clean up the yard, deal with stagnant water, and protect themselves.
But how are we getting persons involved?
So we want to start really with the community engagement, the educational sessions. So we have some target communities, and what we're going to start is by trying to gather them together, mobilize the community, and have some very informal sessions, educating them about, dengue, mosquito breeding, mosquitoes in general, the importance of why we're doing this. And then once we have those sessions with the community, we are then going to move to a massive community-wide cleanup. And this is why it's so important for us to be in the community during that week, so that they can get to know us, not just the persons behind the title, but read as the individuals, right? Know that we love the community, we love the territory, and we're doing this because we want to reduce the burden of disease in the country. So we meet and greet, and then from there we're going to work together with the community to develop the cleanup campaign, and this is where solid waste comes in. So we're actually going to be working with those community members, helping them clean up their premises, identifying where key breeding sites are, what they need to be mindful of. We're going to be helping them move waste, and then the solid waste is going to come in, and they're going to actually help, get rid of all of that stuff. So this would be a great time for the community to really bring out everything that they don't want, everything that we've identified that needs to be removed, and really just clean up their surroundings, trim the hedges, get everything out. We want by the time we leave the community, like they don't even recognize it.
Nice.
Like it just feels like a breath of fresh air.
It's very important. The community engagement is critical, because we have been in the fight for mosquitoes a long time. Aedes aegypti mosquito and dengue fever and yellow fever has killed more people during the Spanish-American War than bullets and bayonets. So it's a long time we're fighting this mosquito problem. And we have identified and come to realize that without people involvement, active, genuine involvement, we're not going to get very far. If we get the active and genuine involvement, and regular, in not just a spur, continuous involvement, we can win the war. But without that, we're not going to. We could carry out all the fogging we want. We could we could spray all we want. The people have to cover their water containers, destroy and remove unwanted containers. They have to clean their premises, and they have to wear all that in the work and so on, and they have any symptoms suspected, especially suspected, wear your long sleeve.
Yeah, we really want to mobilize the community. This is really what this campaign is about. Because once you mobilize the community and you engage them, you actually then foster a sense of ownership and individual and social responsibility, because this is your community. Your children are here, right? Your family is there, right? You don't want them to be at risk. So even if it's not just about you, you have others that you have to consider as well. So once you mobilize them, foster that sense of ownership, and persons come out and they work together with other stakeholders like myself, environmental health, solid waste, the healthcare providers. You actually help to build bridges and interconnectivity between persons, which makes it which will make the campaign more effective, because people will be more likely to work together to see that there's a reduction in the burden.
Definitely. And where do you plan to start?
Well, we are hoping to start in Eastern Long Look. That is the first community we would like to go to.
The communities, Eastern Long Look, Seacoast Bay, Lower Estate, Huntham Court area, and so on, those three, and Postle and so on. We have high levels of mosquito infestation in those areas, which is a serious threat for the transmission of dengue. And therefore, we made contacts with these communities. There's some active groups in these communities and active interested individuals, churches, individual persons who have demonstrated their interest in these communities. And so we'll be fortunately having this program. We'll be educating the community, making presentations, we do cleanup campaigns, and we're treating mosquito places and so on. We tell people how to reduce mosquitoes. We're doing all that in these specific target communities.
Wonderful. So you heard it here. We've had our Chief Environmental Health Officer and our National Epidemiologist here on the program today, talking to you about this mosquito awareness campaign, talking to you about a bottom-up approach with reducing mosquito breeding and preventing the spread of, vectors that cause a myriad of different diseases. And we're here to ask for your assistance. So when we come into the community, come out, participate, hear how to arrest the mosquito breeding problem in and around your community. See how you could build partnerships with both departments, and also from the Department of Waste Management. If you see derelict vehicles, if you know that, this vehicle, has been there for years, contact the Department of Waste Management to see how they could get those vehicles tagged and, removed from the premises, which too will avoid a lot of vector population and what's not. So I would like to thank you guys for coming on the program, sharing this vital information now. And I give you this last opportunity to make any final thoughts.
Again, you say quite aptly, we here to kindly request the support and the participation and involvement of the communities and all the persons in the BVI to help us and be helping them defeat this mosquito.
Just in what Mr. Michael said, I don't want us to do a lot of this. I want that when we come into the communities, we see everybody come out, right? Because I don't want it to just be one subgroup doing most of the work. I want everybody to come out and learn about how we can mitigate the spread of dengue and other diseases, how you can take care of your environment, and just how you can take ownership of your community. So we really want the community to mobilize and come out and support this initiative.
And we really need you to come out and help us fight this bite together, because at the end of the day, we are all vulnerable. You heard how he brought a mosquito from eastern to western. So it's not just localized, but it's a whole of the BVI. So
boss of Antigua too.
yes. So we want to thank you guys for tuning in to the program today. We encourage you to share this information and encourage your neighbor to do weekly surveillance. Come out to these meetings when they're in your area. Do your part to help us mitigate this threat of the mosquito. And let's fight this fight together. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha Latham Humphrey. Thank you for tuning in.